Hi there. There was a significant and very important development that took place in healthcare industry yesterday. This significant development concerns not just doctors, hospitals, but also the common public and patients at large. And what was this development that we are talking about? The Insurance Regulatory and Development Authority in India, which is the IRDAI, has included telemedicine consultations for reimbursement. Yes, those policies which allow OPD consultations can now claim reimbursement for teleconsultations also. This is significant. We all know that India is facing a deluge of non-communicable diseases, and one of the major problems that we face with NCDs is that we are not able to diagnose them in time, number one. Number two, we are not able to prevent complications. Now, one of the reasons that we are not able to prevent both of these is that patients don't adhere to medical instructions or the guidelines that are given to them by doctors. Now, if they are able to consult conveniently and get reimbursed, this would significantly improve clinical outcomes and also health itself. So not only does it help the insurance company by making sure that claim ratios come down, but it also helps doctors and hospitals to deliver better care. But more importantly, the patients are probably able to stay healthier and free of complications, because now they can consult with doctors sitting in the privacy and in their own comfort in their homes. However, we need to get into a little bit of deeper understanding of what this is actually about. So the first thing is, only those insurance policies which allow OPD consultations for reimbursement can allow these teleconsultations to take place. Number two, what it says is that you don't have to file separate claims for this. This can be included in the general claim that you normally follow. And number three is very important. The doctors and the whole system needs to be compliant with the law of the land and the MCI guidelines, which were released in end of March this year. So what do doctors and hospitals need to do? Well, they need to ensure that when they are practicing telemedicine and teleconsultations, they follow the MCI guidelines and the laws of the land. Now in the next 2 minutes, I will talk about what are the 5 things that you need to do or to ensure that you have in order to be able to avail this facility that the insurance companies have provided. So the first thing is, you need to ensure that the patient is identified properly. There should be a system by which you identify the patient properly. Number two, you should be able to take consent. Number three, you should have all the records that went into the consultation, which means the consultation itself, if possible. Number four, you must generate a legal prescription. It's very important. Generate a legal prescription. And last but not the least, you are supposed to ensure privacy and confidentiality of all the records. Now, what are you doing now? This is a question that hospitals and doctors need to ask themselves. Are they practicing telemedicine in compliance with MCI guidelines? So if you are doing it over phone, or you are providing advice over WhatsApp, Zoom, social media, are you sure that they allow you to do all this? That they give you the ability to take consent, record it, put all the records together, be able to produce them as and when required? I'm not so sure. So one thing that doctors and hospitals need to do is ensure that the platform that they practice on helps them to comply with this, otherwise it will not help. The second thing is, please understand that telemedicine is not healthcare e-commerce or some frivolous activity. Telemedicine is a serious healthcare practice, and you need to understand how to do it, especially for specialists and hospitals which are providing tertiary care. This is very, very important and significant for them. Now, what we would like to offer is, I'm happy to give you 2 offers. One is that I periodically do web masterclasses on how to practice telemedicine safely and effectively. In case you would like to sign up for a masterclass, you can log into this page here. We will let you know when the next masterclass takes place and you can attend that masterclass. We are also in the process of putting up an online course for doctors to understand how to practice telemedicine. It will be a slightly more elaborate than this masterclass. It will go into all the details. That course will be up in about a few days from now. The other thing is, those hospitals and specialist doctors who are interested in choosing the right platform, we would be happy to help you. Please call us on this number and somebody will get back to you. Thank you once again. Significant development. Let's keep our patients healthy and ensure that they are free of complications by using all that we have, all the tools that every doctor or hospital can access. Thank you and my best wishes.